Hello, everyone. I'm Philip Osteen, the Interim Dean of the University of Utah College of Social Work. It's my pleasure to welcome you to the college's first Social Work Beyond the Classroom presentation for the 2022-2023 academic year. As the name of the series suggests, these presentations allow us to delve into the work that engages our faculty members outside of their teaching duties and provides learning opportunities for students, graduates, and others in the community. Before we get started with today's presentation, on behalf of the College of Social Work, I am proud to recognize the contributions of our American Indian community members by acknowledging that this land, which is named for the Ute tribe, is the traditional ancestral homeland of the Shoshone, Paiute, Goshute, and Ute tribes. The University of Utah recognizes and respects the enduring relationship that exists between many indigenous peoples in their traditional homelands. We respect the sovereign relationship between tribes, states, and the federal government, and we affirm the University of Utah's commitment to a partnership with Native nations and urban Indian communities through research, education, and community outreach activities. Thank you to all of those who are joining us live today, and a hello to those who are going to be watching this in the future. We're excited today to showcase Dr. Caren Frost and Dr. Jason Castillo, two faculty members in the College of Social Work who are working on an important topic for social workers. Their presentation touches on the state of substance use disorders in Utah and across the country, the Substance Use Disorder Treatment Training Certificate Program offered here at the College of Social Work, and how the HRSA-funded substance use disorder workshops they've added impact paraprofessional students and trainees' knowledge and self-efficacy levels. Following their presentation, Drs. Castillo and Frost will have about 10 minutes for question and answer. So please use the Q&A button at the bottom of your Zoom window to submit any questions that you might have. Now, it's my great pleasure to introduce our presenters. Dr. Caren Frost is the University of Utah's Associate Vice President for Research Integrity and Compliance, a research professor here at the College of Social Work, and the Research Integrity Officer for the University of Utah. As a qualitative researcher with expertise in ethnography and phenomenology, Dr. Frost's research allows her to capitalize on a mixed method framework, emphasizing the importance of the qualitative components of a study. Dr. Jason Castillo is a professor in the College of Social Work and the Interim Associate Dean for Academic Affairs. His research focuses on social work education, substance use disorder counseling, and social welfare policy. Dr. Castillo has been the recipient of 2 large HRSA grants since 2017. These grants involve funding and training opportunities for students at the bachelor's level who are interested in substance use disorder counseling. We hope that this presentation, along with the associated CEU opportunity, will serve you well. Drs. Castillo and Frost, the virtual stage is yours.
So Dean Osteen, thank you. Thank you for the introduction. Thank you for the welcome. On behalf of my colleagues, Dr. Caren Frost and Dr. Chris Camber, I just want to welcome everyone to today's first Social Work Beyond the Classroom event. I've been a faculty member here in the college for about 15 years, and I don't know, if some of you can relate to this, but there's a time in your career when you're like, I really enjoy this, I really enjoy this, and then you find that moment where it's the highlight of your career. And I'm certainly not saying that, this is, the highlight of my career, but I've got to tell you that up to this point in my career, when I look at the substance use disorder treatment training certificate program, the opportunity to work with my colleagues on 2 federal grants, and just to see the extraordinary work that we've done in the SUDC program, this to date is the highlight of my career, and I can't be any more excited to share with you the work that we've been doing over the course of the last 5 years. So as Dean Osteen mentioned, we have secured 2 federal grants over the course of the last 5 years. What I'm going to be reporting on today, or what we are going to be reporting on today, is just findings that we've learned from the various workshops that we've provided to students in the SUDC program. Just to provide you with an idea, what we're going to be presenting on is that, as Dean Osteen mentioned, substance use problem in the United States and the state of Utah. I talked to you about the SUDC program. the impact that our HRSA-funded grant has had on trainees' knowledge and self-efficacy. And then finally, talking about future steps. We're always talking about, this is great when we talk around sustainability. How does this affect future clients, future students and trainees, and then also service delivery providers as well?
Okay, so I think this is me. So I'm going to talk just a little bit about substance use issues in the United States and substance use issues in Utah, as Dr. Castillo just talked about. One of the things that we had noticed when we wrote the original HRSA, what we call HRSA 1 grant, is that the use of alcohol and drugs were increasing for youth and adults across the United States. And for the HRSA 2 grant that we have, which is the one we'll be talking a little bit more about later, we noticed that there is a big impact on the child welfare system when people are having substance use issues. Children are more likely to end up in the child welfare system. Okay, so as you see here, 41% of the cases of kids in the child welfare system, there's a parent with a substance use disorder. 10% of those cases have a parent with an opioid use disorder. And 9% of the children in the child welfare system back in 2017 had a fetal alcohol or drug exposure issue. Okay, and less than 10% of the people who need treatment receive treatment. And this is the big impetus for the HRSA work that we're doing, trying to get more people trained, because if only 10% of the population who needs help, needs treatment, is getting it, we have a significant problem in the United States. Next slide. Great, thanks. Okay, so substance use in Utah, when we wrote the original grant, right, we noticed that there were increased rates of binge and heavy drinking across populations, and that younger adults used alcohol at higher rates than older adults, okay? That the high school youth indicated there was illicit drug use going on, and we're going to talk a little bit about that in just a second. There's been a bit of a shift on that, and we know a little bit more about what those drugs are. And again, the national opioid use is 4.9%, but in Utah it was 5.4%. So we are higher than the national average, which again is an issue that we're hoping when we train people that we'll be able to help address those issues. Okay, yeah, and you can tell Jason did cool slides and I did stupid slides. Okay, my backgrounds are just not as fun. So what we know that during the COVID epidemic, there was a shift in substance use in the United States. And so that we know that by 2020, about 73.8 million Americans had a mental illness and or a substance use disorder. And 15.4% of adults had a substance use disorder alone. Okay, this is a substantial number of people in the United States. We also note that adults ages 18 to 25 and adults aged 26 and older had higher percentages of opioid misuse in the past 12 months than did youth 12 to 17. And that opioid misuse is really about primarily about prescription pain reliever misuse. Okay, and I think that we kind of had an inkling of that for a number of other things that we have seen in the news recently, and that people who are older than 25, about 3.4% misused opioids in the last 12 months. Okay, and again, prescription pain use is people are purchasing them or stealing them from friends and family or buying them in certain places, and they just have access to this very easily. So, all right. So substance use post-COVID, and I think post-COVID probably is not quite the misnomer, the name that we want there. We know that this is from like 2020 forward, and some of this information is based on the work that Dr. Chris Caren has done, and I know he's in the audience. So if he wants to add some stuff in here at the end, that would be fantastic. That the idea of traditional substance use is declining, okay? But what we are seeing is vaping rates are increasing, and I want to see what that looks like now that there is some legislation about who the vaping groups can target. right? There's an increase in e-cigarettes, cigarettes, cannabis, and heavy alcohol use. And those are linked to youth who are in psychological distress. And I think that really speaks to the isolation, the anxiety that youth feel and have felt during the COVID-19 epidemic. I think that, we see this in older adults, but younger adults particularly are under a lot of psychological distress. The death rates due to substance use overdoses are increasing, and that has to do with the potency of synthetic opioids, another big issue. Okay, so yeah.
So as you can see, I mean, substance use is very much an issue in the state of Utah and across the United States. I have to say that when we think of the College of Social Work here at the University of Utah, it's a college that's been here since 1937. We talk around our Master's of Social Work program, our doctorate program, and also our Bachelor's of Social Work program as well. In that time, three programs. In addition to that, we also offer 2 graduate certificate programs and 2 undergraduate certificate programs. And also, when we look at social service workers, we also offer a number of courses there as well. So I make that information available because, the College of Social Work are degreed programs. However, when we look at higher education and, the changes around higher education, getting students, up to the university, getting them, retention, persistence, graduation, or completion, we are really talking about, one of our major certificate programs at the undergraduate level. So I'm not certain if everyone is aware of the SUDSI program. The SUDSI program has been a part of the College of Social Work since the early 1980s. Since that time, we've trained hundreds of individuals to go out into the field and practice as a substance use disorder counselor, and later on as an advanced substance use disorder counselor. In 2011, the Utah State Legislature changed it where persons must be working towards their associate's or their bachelor's degree to serve in either one of these 2 capacities. And really, when we talk around that, I mean, it really is, at that point, professionalizing the field in a way that it might not have been before. And so when we look at the mission of the SUDSI program, it is indeed to provide students with basic and advanced knowledge and skills essential to preparing them to practice as a substance use disorder counselor. So again, when we look at the SUDSI program, it's been around for a considerable period of time. We've graduated hundreds of students over that time. Most recently, when we look over the course of the last 5 years, we've admitted about 161 students into the program. 85% of those students have completed the program. And when we talk higher education, it's important to keep in mind that, we're talking undergraduate education, but, I'm really pleased to say that about 40% of our graduates from the SUDSI program, they have then gone on to graduate school. So when we look at the SUDSI program as a certificate program, we are really talking about a pathways to education where students have also then gone to earn their bachelor's degree and also their master's degree in social work as well. So again, SUDSI program, preparing students with the basic and advanced knowledge and skills to practice as an ethical, competent, and professional substance use disorder counselor. Okay. Again, when we look at, the role of a SUDSI or an ASUDSI, there is this part, what is it that they can do? And, one of the things that I always communicate with prospective students, current students, graduates, executive directors, licensed clinicians, when we look at the work that our SUDSIs and ASUDSIs can do, it really does run the gamut from intake, screening, administrative intake, assessments, facilitating orientations with clients, helping in the construction of a treatment plan, leading and facilitating group sessions, one-on-one interventions under the supervision of a licensed mental health therapist, provision of case management services, crisis intervention services, providing client education, referring clients on to appropriate services, reporting and record keeping services. And when we talk around the world that we operate in, it's not uncommon that we're engaging with other professionals, whether it's medical doctors, whether it's law enforcement, criminal justice system, other therapists as well. And so a part of that is indeed consulting with other professionals. So I bring this up because I always want to make it clear that when we're talking about our SUDSIs and ASUDSIs, when we look as far as, the micro, the meso, and the macro, that our students are really provided with an education and training that provides them with the knowledge and the skills to operate each of these respective areas. Certainly when we talk around a direct practitioner role, and later, when we get into the plan of study, talking around an indirect practitioner role, when we talk around, working with agencies, organizations, and also around advocacy as well. So again, when we look at, the scope of practice for SUDSIs and ASUDSIs, intake, screening, assessments, treatment planning, counseling sessions, working one-on-one, case management, a lot of education, and then also working with other professionals and other service providers in the community. When we look at the SUDSI program in particular, we are really talking about a combination of different elements, led by didactic classroom instruction. Our students also complete a field practicum training piece. What we are going to be reporting on in today's workshop is really the findings around various workshops. I want to say these supplemental workshops are different substantive areas than what students are receiving in the didactic classroom instruction. So when we were awarded the grants, the grantor, that was really one of the things that they were looking at, that, this is business as usual. What are you doing in addition to that? So certainly working with our community-based providers, looking at evidence-based practice, what was the content and the knowledge and the skills that students needed, to work in a rapidly evolving workplace with a diverse clientele and population. More recently, when we look at this apprenticeship opportunity, when we look at apprenticeships in the United States, historically, it's been really in the vocational trades. So when we look at, electrical, plumbing, we are now starting to see apprenticeship opportunities move into the health arena. So when we look at phlebotomy, when we look at dentistry, when we look at certified nurses assistants, this is one other area where when we look at the Department of Health, really looking at this as being a place where, there's such a shortage of healthcare providers. There's a shortage of substance use disorder counselors. Is there a place for paraprofessionals to work in the systems of care? So here throughout the United States, the U.S. Department of Labor, also here in the state of Utah through our Department of Workforce Services and the state of Utah Department of Labor, making a concerted effort at making apprenticeship opportunities available to students who have completed the SUDSI program. So we're not going to be talking about our apprenticeship opportunities today, but for those of you that are definitely, in the audience, those of you that may be working with paraprofessionals, volunteers, other persons that may be looking for additional education, certainly there's the SUDSI program, and a part of the didactic field practicum supplemental workshops is indeed an apprenticeship opportunity as well. So when we look at the SUDSI program, this is a program that students can complete either for credit or non-credit. Speaking to credit, students can complete the SUDSI program in 14 credit hours and the ASUDSI program in 20 credit hours. For SUDSI students, they complete a 200-hour field practicum placement. For our ASUDSI students, they complete a 350-hour field practicum placement. I know that you see down there on the bottom 200 to 450 hours. Please know that the 450 hours is really for those students that are working towards their bachelor's degree and the SUDSI certificate. All right. And so as you can see, the curriculum, the programming, it does run across the board, dynamics of addiction, introduction to professional development. What is it to be a licensed substance use disorder counselor or an advanced substance use disorder counselor? What is the scope of practice for each one? How do I become licensed? What is the national examination? And so really that is preparing students to the profession and what is required for them to become licensed SUDSIs and ASUDSIs in the state of Utah. Counseling Practice 1 is really around the area of assessment. And so when we look at the ASAM criteria, that is what our counseling, that is what our SUDSI students are getting in that class. When we look at the neurochemistry and the psychoactive substances classes, this is a class that is taught by licensed pharmacists. And so when we talk around, the different types of substances out there, what are they? What are they intended for? And then also, what is the effect that it has on the brain? When we look at Counseling Practice 2, we are really talking about, how to lead or how to prepare, plan, lead, and facilitate group sessions. I got to tell you, one of the things that I'm always fascinated by with my BSW, MSW students, and SUDSI students is you're doing a lot of group work. And so a part of that was really having a class that's concentrated on how to lead, prepare, facilitate a group session. So, when we look at AA meetings, when we look at NA meetings, when we look at, refuge, just a number of different group interventions with diverse populations and groups, but how to lead and facilitate these different groups. When we look at advanced professional development, there is very much the work that we do with our individual clients, that we do with our families, that we also do with our groups as well. One of the things that we talk about in advanced professional development, and certainly when we look at the code of ethics for a SUDSI and an ASUDSI, is how to work with policymakers, elected officials, executives around changing policy, changing the systems of care, program services. And so part of that is how do we operate at the macro level? So when we look at advanced professional development, it is how do we work really with decision and policymakers. When we look at Counseling Practice 3, this is a course that is really geared for students to work with individuals. So this course is heavily inclusive of cognitive behavioral therapy, dialectical behavioral therapy, and then also motivational interviewing as well. So again, when we look at Counseling Practice 3, when we look at the scope of practice for a SUDSI, ASUDSI, is them being able to intervene utilizing those particular interventions and techniques. When we look at Counseling Practice 4, we are really talking about working with persons in recovery and working with their families. So when we talk around, I believe the craft intervention, that is really what we are focused on in Counseling Practice 4. And when we look at this, students complete, this is all the didactic instruction, classroom instruction at the very bottom. Once students have completed all of their didactic instruction, they then complete their field practicum placement or their field practicum training hours. When we look at the number of field practicum agencies we have in the SUDSI program, we're looking at about 80 to 100 agencies. So we've got a really, really outstanding relationship, a number of partners that place SUDSI students to do their field practicum placements. All right. And as Dr. Frost was talking about earlier, we very much have the issue of substance use in society. Really, when we look at the two grants that we are working on, it's really looking at, what is the impact that substance use has on the health and well-being of families. So when we look at the number of children that are entering into the child welfare system or are being seen by the child welfare system, a lot of times, it is households in which substance use disorders are present. In addition to that, we are also talking about just a shortage of licensed substance use disorder counselors, especially in underserved areas. So for example, when we look at the state of Utah, every county in the state of Utah is a medically underserved area. And so really when we look at this training opportunity, it really is, again, to provide the education and training to students, not just to stay, in Salt Lake City, Salt Lake County, but where they might be able to go into other counties, other rural areas with diverse populations. So recognizing the shortage is really one of the things that when we look at the federal grants that are coming out, that's really one of the things that they're looking for, right? And so part of that, looking for a well-educated, trained workforce to work in the area of prevention, treatment, and recovery. Okay? And I will turn it over to Dr. Frost.
Great. Okay. So in 2016, Dr. Castillo and I worked with a number of colleagues here in the college and went ahead and applied for a HRSA, our first HRSA grant, and we got it. It was exciting, right? Yay. So that grant is now completed. And what that one was doing was providing funding for students to get people trained, but also to think about working in medically underserved areas with medically underserved populations. Okay, so anyway, that was the first grant that we had, and we got that off the ground, and yeah, that was wonderful. I think the students liked participating in it, so that was good. We're still analyzing some data from that right now, and then in the midst of that, as we were moving toward the finish line on HRSA 1, there was an opportunity for us to write a second HRSA grant. And this one actually really focuses on substance use disorder counselors, but also thinking about how we support families for whom somebody in the family has a substance use disorder. So while it's not necessarily focused on medically underserved areas or populations, we still have a focus there with that. So we have that grant, and that is ongoing until 2024. But what is common through each of these grants that we have is that we provided supplemental workshops for students. And one of the people in the audience, Dr. Kathy Supiano, has done one of our workshops. So at some point, I know she could talk about that too. That went really well. They're on Saturdays. Every semester, we pick one Saturday. They're for 4 hours. They're interactive. They address a different topic, but they're related to things around substance use. And one of the things that Dr. Supiano addressed was grief and loss when someone you know and love has passed away because of a substance use disorder. So it's not just that we're focused on the substance use piece, we're also focusing on how we work with families in different areas, and in providing treatment and in developing our skills to be substance use counselors. So, Jason, did you want to add anything to that?
Yeah, when we look at the HRSA 1 grant, as I shared with you earlier, we admitted about 161 students. Again, 85% completed the program. When we look at the measures as far as attending class, so both process and also outcomes, certainly students attended class. When we look at as far as GPA, when we look at class assignments, we did see we certainly have that data and information. It's really the workshops that I'm really excited to share with the group. Again, we're recruiting students into the program. We're retaining the students in the program. Students are persisting in the program and then also graduating. So that's just one of the things that I'm extremely proud of with the SUDSI program and also these two grants. In addition to what Dr. Frost was mentioning, again, recognizing the cost of associated with higher education and recognizing the shortage of SUDS, HRSA, that's really what they were doing, is making a concerted effort at getting more students into programs like the Subsea program. And so one of the things, when we look at the funds that were made available in these two grants, funds are made available for students in the form to cover tuition. And then also there are funds, stipend funds that are available to students as well. So I know one of the things that I communicate with students is, school is, when we look at our students, a number of working part-time, full-time, balancing work and family, and, also paying for their education, that through the HRSA grant, we are able to make these resources available to students, and we're also able to pay students to go to school as well. In addition to this, the HRSA grants, with the first grant there, we were one of 20 programs across the United States that was awarded with this federal grant. When we look at the second grant, we were one of 35 programs across the United States that was funded with, that was awarded with funds. Combined, these two grants were in the area of $3.3 million. And so again, when we look at the issue of substance use, if we look at the impact that substance use has on individuals and families, when we look at the shortage of substance use disorder counselors, HRSA, along with the College of Social Work and the Subsea program, are committed to, one, getting students into the program, getting them through the program, but more importantly, providing them with the knowledge and skills that they can go and practice. I see there's a question.
Oh, yeah. And I think we should add something just about, again, let's talk about the apprenticeships one more time, because this is really important stuff. Yes.
All right. And I don't know, are we taking questions during the presentation, or are we taking them after?
We can take them after.
Okay.
Okay. So Maddie, can you wait, and we'll address that at the end? Promise.
Okay. All right. Dr. Frost.
Okay, so we began offering our workshops. Like I said, they're 4 hours, they're on Saturday, they're one every semester. They're short workshops, but they're based on the evidence. And we have the practitioners, the researchers in the field who are presenting and getting interaction going on. Now, of course, part of this happened when there was COVID, so we had to do some of this over Zoom. And I know it wasn't as interactive as people wanted it to be, but now we're back in our building, and on December the 3rd, we're going to be having a workshop. It's going to be fantastic. But the content is really focused on what's outside of the curriculum. Oh, you changed on me. Okay. What's outside of the curriculum? I'm awake, right? What's outside of the curriculum? So here are some of the workshops that we have offered, particularly well received. We did the lately, when we had done the one about the harm reduction approaches, the grief and loss after overdose, those were really pertinent for a lot of the students in those workshops, right? Very, very helpful. Anyway, so we have presented all of these things. There's the screening, brief intervention, and referral treatment expert. Again, everybody loved it. There was the more mindfulness-oriented recovery enhancement. We focused on DBT, but that was really augmenting what was going on in the classroom, so people get a much more focused discussion about this, how to do clinical assessments, suicide risk and evaluation. Anyway, and Dr. Castillo had mentioned there was a craft presentation. We did one about prenatal expert, and that was really well received. And we are going to, in the December workshop, is going to be talking about substance use and treatment with our executive director of the Indian Walk-In Center, which I think is called the Urban Indian Center now. So Christina Graves is going to be presenting that. So we're focusing on topics, but populations. Anyway, it's very, very in-depth, focusing on things outside the classroom. Did you want to say? Okay, great.
Thank you, Dr. Frost. And
Yep.
As Dr. Frost mentioned, none of this happens without our partners out in the community, clinicians, other researchers, those that are understand, in a different degree, as far as, hey, Jason, it'd be ideal if we could have, a workshop on this. And so I know even during the summer of 22, Dr. Subiano reached out to me, and I think we were able to pull that together. I want to say in almost like maybe a couple of months. I think it was a couple of conversations, but got her lined up, and yeah, just took off in the summer. I think right then in the early part of August. And yeah, we partner up with our colleagues in the community. We look at what's going on at SAMHSA, what's going on at various addiction centers across the western region of the United States, just because we understand that, hey, our students, they need this information. They are going to be going out into the field, and this is what the field is asking for. So when we looked at the development of our workshops, it was very much with all of that in mind, and then also to bring in information that wasn't being covered in the classroom, or if there was an opportunity to augment that and supplement it as well. It never fails. I'll be at graduation, students will be walking across the stage, and they'll be like, Jason, I don't think I'm ready. And the same thing after a 2-3 hour class, like, Jason, I got a percentage of that. So really what the workshops is intended to provide more concentrated experiential opportunities for students, one, to learn and to demonstrate these skills that are being utilized in the field. So there's this part that, as a classroom, as a faculty member, we typically have, assignments, we have quizzes, we have discussion posts, we have examinations, written papers. One of the things around the SUTC program is it is experiential. That's one of the things I always communicate with the students, is that we want you to be able to demonstrate. We want you to be able to demonstrate the skills. And so, as you can probably guess, there's like, hey, are we doing what we say that we're doing? And so when we talk around data collection, I mean, it is, these supplemental workshops, working with our colleagues who are the subject matter experts, working with them in the development of a survey. I know that Dr. Chris Cameron is our evaluator on the grant, and does a really nice job communicating with the facilitators of these workshops in developing the surveys that will be administered. So I've done a really nice job around knowledge items, and then also self-efficacy around, how comfortable are students in using the skills that they've acquired in the workshop. So again, as Dr. Frost mentioned, every semester we have a 4-hour workshop. It's typically offered on a Saturday morning, typically at the end of the semester. We provide them with breakfast beverages. I'm not saying, the breakfast is, it's probably closer to a continental breakfast than anything else.
Or like granola bars and oranges.
Yeah, exactly.
Yes.
Exactly. And so, yeah, so, we get the students here, it is, some lecture, but it is very much application, and, and then also, the facilitator speaking about it, demonstrating, coaching, guiding, and then the students demonstrating it as well. So when we look at the 13 workshops that we've had, and, just when we look at the general overall findings, across all of the workshops, we did see a statistically significant increase in knowledge related to that particular modality. And so I'll get there in the next couple of slides. When we look at self-efficacy, and I got to tell you, you learn these things every time that you have a workshop. It's like, hey, Jason, what about including this measure in the survey? And I'm like, yeah. I was like, why didn't we think of that before? And so again, started off with knowledge, later on included self-efficacy into our instruments. And I can say right now that with all of our surveys, that we do account for both knowledge and self-efficacy as well. So when we look at our findings for knowledge, I mean, you can see across the board, all of the workshops, the knowledge for students, it did increase. when we look at the knowledge increase, and then just also, changes in standard deviation, changes in responses from the pre to the post test, the ones that we saw the most change in was right there in the clinical assessment workshop, followed by the motivational interviewing workshop, which was in person, and then also the motivational workshop that was held virtually as well. So again, one of the things that I'm excited about is that we provide the workshops. Students, they complete the pre-test at the beginning, post-test at the completion, and we did see changes in the scores on the tests around knowledge across all of the workshops. Okay. When we look at the findings for self-efficacy, again, we saw statistically significant change in an increase for students in all of the workshops, with the exception of 2. And again, self-efficacy, how comfortable do you feel demonstrating this particular skill in practicum or with a client? And so, as you can see right there, motivational interviewing, students feel comfortable with craft. They felt comfortable, and then also mindfulness-oriented recovery enhancement. But again, when we look at harm reduction, integrative medicine, we did see an increase in self-efficacy among the students on their pre and their post test. So, conclusions.
Is that me?
That is you.
That's me. Okay. So in our conclusions right now, because, we're still researching this and still analyzing some data around this, the in-person experiential workshops, they can be used to increase knowledge and self-efficacy for our paraprofessionals. So that's really important, because there's not much in the literature about this. We've done a scoping review, which we're finalizing, and we don't know enough about what works for paraprofessionals in increasing their knowledge and self-efficacy. So that's good. Whether it's in person or virtual, it seems to be across the board that we're able to do that, increase both of those areas for people who are paraprofessionals. The presenters have really been impressed by the knowledge levels the trainees actually bring to the discussion. So when they throw out a question as a facilitator for a workshop, and almost all of the students or trainees say, "Oh, I know that because I had that in this class," or "in my practicum it's this," or "I have discussed this," the presenters have been really impressed with their knowledge levels, which is wonderful. It speaks volumes to our SUDSI program and our teachers. And the trainees have really said, as they're walking out at the end of a workshop, how much they have enjoyed the interactions with the practitioners. Sometimes there was one workshop we did where we ended at 1 o'clock, but I actually couldn't get everybody out of the room until about 2, because people really wanted to spend more time talking to the presenter, who are, these are all practitioners in their field, just really enjoyed being able to have those conversations. So one of the conclusions is that this has a very positive impact all the way around, as far as we can tell.
Dr. Frost, just one thing to mention on this last bullet item, just to give the audience an example of our community-based partners. I want to say it was the integrative medicine workshop where we were talking about diet and nutrition. Again, not anything that the students received in their didactic classroom instruction. So a medical doctor was facilitating the workshop, and also did an exercise around acupuncture. But what was fascinating about the training is the number of students that stuck around afterwards. And one of the things that the program was able to secure at that point was this person, this medical doctor, and then also this agency as a prospective field practicum placement in the future. And so when we look at, it's not just providing the workshops, it's also building a community with our community-based partners, and also building a future field practicum placement for our students as well.
Yes, excellent point. Mm-hmm. All right, so our future steps are, of course, we're going to continue to provide in-person workshops as we can. Hopefully we won't have to go back to virtual, because I think everybody really appreciates being able to come into the room, not only interact with the presenter, but interact with one another, okay? And then one of the practical workshops that we are hoping to offer sometime in the next year, we'll be looking at naloxone, that's right, toolkits and trainings. We know that Parka Parley's has done that, but we'd like to offer that for our students as an applied workshop. And we would like to increase the number of people who are enrolling and completing the SETC program. Even though we're doing really well about having people complete, we would like to have more students involved. And we are continuing to recruit people who are the paraprofessionals who are working in underserved areas. And one of the things that we are hoping is that as people are moving through the SETC program, they'll move into the next step, which is the apprenticeship piece, which is part of the HRSA 2 grant. So we are working on that as well. So yes. And here's 3 articles we've put out there. Yay. Okay. So we're about to put out a 4th. We've had 2 of them. One of them has been submitted. No, 2 of them have been accepted for publication. So that's fantastic. We're very excited about that. And one of them, it was a revise and resubmit. So we've done that. And then we have our scoping review, which we are hoping to get submitted later on this year. So anyway, and Jen just put in the link for more about the SETC program. So yay. Thank you, Jen. All right. So those are our future steps.
And thanks, Dr. Frost. And, you know, adding to that, I mean, certainly when we look at our Research One institution, when we look at, you know, when we look at our mission as a college, and, you know, when we talk around, you know, through research, education, you know, transforming policies, programs, and services, I mean, this is really an effort that I think does represent all of that. And so as we've shared with you, I mean, this is a program that has been around since 1980. You know, when we look at, you know, after the legislative change in 2011, when we look at the number of students, you know, changes in our curriculum, I mean, we've got a really good vehicle. We've got our community-based partners. Really, when we look at future steps, it is obviously an opportunity to continue publishing. In addition to that, when we look at the apprenticeship opportunities that Dr. Frost was mentioning, there's also additional opportunities to continue reporting or writing for funding in this area. So whether it's through the U.S. Department of Health, HRSA, I know one of the things when we look at the state level is really talking about funding for apprenticeships. So again, when we look at the state of Utah Department of Workforce Services, I know that they have an apprenticeship office. When we look at the state of Utah Department of Labor, again, apprenticeship as well. So really other future steps, continue to publish, continue to write for external funds. Again, for the biggest goals, continue providing, you know, resources to help students, you know, procure the education and training in here, but most importantly, being able to have the knowledge and skill set to go out into the field to practice in an ethical and competent manner. So again, massive shortage when we look at the students. Again, we can go across any industry. It doesn't matter if it's healthcare, if it's education, if it's criminal justice, corrections, you know, forensics, aging. There's an opportunity for students to experience, you know, what might be going on in around the area of substance use. So again, if you're working with paraprofessionals, if you have case managers that are interested, then we would love to speak to them. I think this is an opportunity where resources, funding is made available. And I can't say enough about the curriculum, about the instructors that teach in the program. All of them are practitioners out in the field that are working with clients on a day-to-day basis. So again, the curriculum's there, faculty's there. We've got a track record as far as, you know, making provisions available to students. And we would just invite you as our colleagues out in the field, if you know of anyone, let them know that, you know, that we're doing some pretty exciting work and we'd love to have them here. So with that, any questions?
Yeah, so Dr. Castillo, Maddie's asking a question about what month in 2024 does HRSA 2 end?
Yeah, it ends August 31, 2024. So we've got a little over 18 months, 2 years, as far as where funding would be made available to students. And yeah, now is as good a time as any. So we admit such a program. We have 2 admission cycles. We admit for the fall semester and the spring semester. Unfortunately, the window for admissions just closed. We're going through the admissions for spring semester 23 right now, but we will be admitting a new cohort for fall semester of 23, and would love to have people come be a part of the SUDSI program. Any other questions?
So Troy Bennett is asking us, can you talk a little bit more about how you are measuring self-efficacy?
Yeah, I don't have any of the instruments in front of me right now. And Caren, did you say Chris was in the audience?
Yeah, Chris is in the audience. Chris, now we're going to put you on the spot. Can Chris come off mute? I don't know if he can. Can he? Yes, there he is. There he is. Yay.
Thanks, Chris.
Okay. And while we're getting Chris up and running here, Maddie has another question about, do you foresee the workshop staying around forever? That would be fantastic if that could happen, but I'm going to let Dr. Castillo answer that.
Yeah, certainly when we look at the evidence, not just the evidence-based literature on these particular interventions, I think there is a place. I mean, as an instructor, I mean, one of the things that we always run into is too much information and not enough time. And certainly when we look at these workshops being exponential in the way that we are, that is very much our plan. Is to continue offering this supplemental training to students. Again, funding is always one of the things at the back of our mind, but I think we've shown that we can successfully do it. When we look at certainly funding in the college, I think this is very much an element and component that will continue to be offered in the future.
I think we're going to, Troy, we can email you that information about the specific questions that we're asking. Okay, will that work for you? Great. Okay, good. He said perfect. Thank you.
Sorry about that, Troy.
Mm-hmm. Yeah, we put Chris on the spot, and I don't think he was actually planning on speaking. So okay. There we go. Again.
Anyone else? I see Q&A. Let's see here. So I see CB. I've only ever seen people without a clinical license in a SUDSI class. Is there any reason to suggest someone with a license to take this program? Sorry if this was already answered. I think this is a really, really good question. And it's interesting. One of the articles that was accepted for publication was right around the inclusion of substance use content in undergraduate social work programs. But I can tell you that when we look even at graduate programs, graduate social work programs, there's just not a lot of content around substance use in MSW and BSW programs across the United States. So one of the things that I communicate with folks is that look, there's an opportunity. You may very well be working, in the area of mental health. You may be working with, co-occurring disorders. I can tell you right now that that when we look at, just the education and training around substance use, students are typically afforded with one elective course in the area of substance use concentration. And so along those lines, yeah, I think absolutely, if persons, already have a graduate level degree and they want to learn more about substance use education, there's very much an opportunity here. In fact, we have, again, of the 161 graduates or persons that completed, I believe 2 or 3 of those persons were indeed MSW, LCSW as well. In addition to that, I know up on the Hill, there is some conversation around around like, hey, you know, I get that you might be an LCSW, a CMHC, but across the United States and now in the state of Utah, people are talking about, you know, master's degrees in addiction. So there is something to be said, you know, as far as a specialty. I just think that there's an opportunity. I mean, we're lifelong learners, and I think you know, the curriculum and again, what I see in curriculum across the United States around substance use, there's just not very much content. So yeah, I would absolutely encourage folks to look at this as an opportunity to learn more about substance use. Right.
Great. Yeah, we've answered all the questions, and Jen has put more. Oh, Chris was listening while he was walking his dog, so he can't answer.
Sorry about that, Chris.
No, sorry, Chris. We didn't mean to put you on the spot. So sorry. But thank you, Jen, for putting all that information in the chat for us. That's fantastic. Okay, I think we're going to turn it back over to Dean Osteen and let him close us out.
Thank you so much to both of you, Caren and Jason, really just taking time to come and share your experiences with us, your research with us, and really your service on this issue. I always want to acknowledge our development and PR teams, who are the ones who make this happen. Without them, none of us could be doing what we're supposed to be doing. Certainly a thank you to everyone who joined us today, and again, for those who are going to be watching this in the future. The College of Social Work is committed to taking the evidence generated through our research and from our labs, not only to use with future social workers sitting in our classrooms, but also out into the community and to practitioners beyond our state lines. And you'll see that's why we call this Beyond the Classroom. We want to make sure that the work that we do in the classroom does get disseminated as far as we can. We hope that you'll join us throughout the years. We continue to share our work and explore other evidence-based solutions to various challenges, both in the state of Utah and beyond. We have 2 upcoming events that we hope you will be able to join us for. Jen did post that link, but on October 18th, we're featuring a special guest, Dr. Robert Edwards, who is a world-renowned pain psychology researcher at Brigham and Women's Hospital and at the Harvard Medical School. He will discuss factors that influence pain, the intersections between pain and opioid misuse, and the implications for personalized treatment in which therapies are tailored to an individual patient's characteristics. It's a fantastic opportunity for our community, and so I hope you can join us there. On October 26th is our first Grand Challenges for Social Work event of this year. This hybrid event will feature distinguished alum Michael Bird, who will share how he's worked with numerous American Indian, Alaskan Native, and Native Hawaiian communities to address health disparities and strengthen access to culturally appropriate public health and behavioral health services. Again, you can find details about these and all of our events on the college's events webpage. So again, on behalf of the College of Social Work, our faculty, our researchers, our students, thank you to each and every one of you for joining us today. I hope you have a great afternoon.
Thank you.
Thank you.